Every 43 seconds, at least one child dies from pneumonia. Almost all of these deaths are preventable. It is inexcusable that thousands of children are exposed to unnecessary risks and unable to access the essential health services, vaccines, and treatment, which can prevent pneumonia and save their lives. What causes pneumonia? Pneumonia is an acute respiratory infection of the lungs. It doesn't have one single cause. It can develop from either bacteria, viruses, or fungi in the air. When a child is infected, their lungs get inflamed, may fill with fluid or pus, and it becomes difficult to breathe. Children whose immune system are immature, that is, newborns or premature babies, along with those with poor immunity due to undernourishment or disease like HIV, are more vulnerable to pneumonia. What are the symptoms? As pneumonia is an infection of the lungs, the most common symptoms are coughing, trouble breathing, and fever. Children with pneumonia
You're
usually
okay,
experience
sweetie.
fast breathing,
Just checking your
or
breathing
their
now.
lower chest may draw
Nice and
in or
easy.
retract when they inhale. In a healthy person, chest expands during inhalation. Is pneumonia contagious? Pneumonia caused by viruses or bacteria is contagious and can be spread through airborne particles, a cough, or a sneeze. The pathogen that causes pneumonia can also be spread through other fluids like blood during childbirth or from contaminated surfaces. Not everyone exposed to pneumonia causing pathogens will fall ill or get pneumonia. How is pneumonia diagnosed in children? Health workers can diagnose pneumonia through a physical exam, including checking for abnormal breathing patterns and listening to the child's lung. Sometimes they may use chest X-ray or blood test for diagnosis. In countries without strong healthcare system, means the few doctors, lack of access to chest X-ray and laboratories, then the health worker often rely on the diagnosing pneumonia by counting the number of breaths the child takes per minute. For instance, a 5-month old child who takes 50 breaths per minute would be breathing too fast and could have pneumonia. The number of breaths for fast breathing depends on the child age. Younger children normally have higher rate of breathing than older children. Health workers, if equipped with the right tools, can also check if a child has low blood oxygen level, an indicator of severe pneumonia. Then we understand what is the treatment protocol for this. The treatment for pneumonia depends on the type of pneumonia. In developing countries, large numbers of pneumonia cases are caused by bacteria and can be treated with low cost antibiotics. Yet many children with pneumonia do not receive the antibiotics they need because they lack access to quality healthcare. Other causes of pneumonia are viruses or mycobacteria requiring other treatment. Tuberculosis, in a particular, often remains undiagnosed in children. Then, what role can oxygen play in the pneumonia treatment? Oxygen is an essential and life saving treatment for children and newborn suffering from severe pneumonia. That's because the inflammation of their lungs prevent enough oxygen from entering their bloodstream to be circulated to the rest of the body. Low blood oxygen level can be measured with the pulse oximeter. Access to pulse oximetry and oxygen has for a long time been unavailable to those who need it. In many countries without strong health system, oxygen is often only available at higher level health facilities and hospital. Then we can discuss about the what can be done to prevent pneumonia. Preventing pneumonia is possible through increasing protective measures such as ensuring newborns and young children are breastfed early, vaccinated, have access to clean water, good nutrition, and limited exposure to the air pollution. Studies have shown that the good hygiene practices, including improved hand washing with soap, reduces the risk of pneumonia by lowering exposure to bacteria. Then we discuss about the pneumonia vaccine. Is there any pneumonia vaccine? Pneumonia caused by bacteria is easily preventable with vaccines. However, 33% of the children around the world are not fully protected with the primary vaccine to prevent pneumonia, the pneumococcal PCV vaccine. In addition, other vaccines such as DPT, means diphtheria, tetanus, pertussis, and measles containing vaccine, and Haemophilus influenza B vaccine protect children from pneumonia. Where are the most children dying from pneumonia in the worldwide? The region with the largest number of child pneumonia deaths are concentrated in sub-Saharan Africa and South Asia. Child death from pneumonia are concentrated in the world's poorest country. Within these countries, it is the most deprived and marginalized children who suffer the most. They often have limited or no access to basic health services and are most likely to suffer from other health threats like malnutrition, infectious diseases, and polluted air. They often live in fragile or humanitarian setting where often risk factor increases and health system breakdown. Then we discuss about how does it air pollution factor into pneumonia. Air pollution can significantly increase the risk of respiratory infection, including pneumonia. Almost half of all pneumonia deaths are attributable to air pollution. The climate crisis is a child right crisis and poses a serious threat to children's health and well-being. Outdoor air pollution is a risk to children, especially with growing rates of urbanization in high burden pneumonia countries. But indoor air pollution generated by unclean fuels for cooking and heating also poses a global threat. How big a factor is malnutrition in pneumonia related deaths? Wasting is the leading risk factor for deaths from the pneumonia among children. It is most visible and life-threatening form of malnutrition. When a child is too thin and their immune systems are weak, they are far more vulnerable to disease like pneumonia. Wasting tends to occur very early in life and disproportionately impact children under 2 years of age. It's essential that we invest in nutrition services to prevent children from dying from pneumonia. What is needed to stop pneumonia? Swift action and investment are required to ensure that no child dies from pneumonia and other preventable or treatable diseases. This includes reducing risk factors. Number two, protecting children's immune system. And number three is ensuring all children have access to good quality healthcare free at the point of use and with well trained and equipped health workers. What UNICEF is calling for: strengthening and prioritizing of routine immunization and scaling up coverage of PCV vaccine, measles vaccine, DTP vaccine to above 90% to ensure every child is protected from pneumonia, making low cost antibiotics for the treatment of pneumonia available at last mile close to where children live. Number 3, improving basic oxygen access and use so no child is left fighting for breath. Investing in the prevention and treatment of severe acute malnutrition to reduce risk child death from pneumonia. Continued action to engage and empower communities to support prevention and treatment. Urgent action is needed now to end that preventable death caused by pneumonia. We can change the course of this disease and help keep children alive. And mainly, many people associate pneumonia with the elderly, but it is actually the biggest infectious killer of children worldwide. Every year, pneumonia claims the lives of more than 7,25,000 children under the age of 5, including around 1,90,000 newborns who are particularly vulnerable to infection. If you like the video, please subscribe the channel, like the video. Thank you.